I'm Dr. David Weed. I'm Executive Director of Partners for a Healthier Community. And one of the things that Partners is responsible for is to create an action plan every 5 years that will describe not only the health challenges for our area, but also a plan of action, something that details the kinds of steps that we're going to take over that next 5-year period to address some of those health challenges. Partners was established, as you can see by the slides up here, as one of the 27 health network areas throughout the state of Massachusetts. And as such, we're responsible for the assessment and planning of health initiatives for Fall River and 3 surrounding communities, Somerset, Swansea, and Westport in Bristol County. Partners is organized as a 501c3. We have a 25-member steering committee and currently 4 task forces. We also have 3 full-time staff members paid for through a budget that's under $160,000 a year, which primarily is funded by determination of needs support from the area hospitals. We have a design team that assesses and evaluates, organizes surveys, collects data, and analyzes it every 5 years to establish goals and benchmarks. We work with all sectors of the community to create that plan with specific objectives, and that's what we're here today to discuss. The design team meets quarterly to share information and does an annual review so that that plan is updated. Partners was helpful in earning Fall River one of 6 national prizes awarded by the Robert Wood Johnson Foundation. That prize recognized Fall River and 5 other communities across the country for their excellence in work in improving health in the community. That wasn't a prize recognizing Fall River as a healthy community, but one that understood what it would take to create a healthy community. The next 6 prize winners, by the way, will be introduced in a few weeks when the Robert Wood Johnson Foundation announces the new prize winners, and representatives from Partners will be going to Princeton, New Jersey to join that group at that time. The health challenges in Fall River are related primarily to the various characteristics of the population. And without going into a great deal of detail, we suffer from a variety of issues that create difficulties with people maintaining health. One of the primary ones being poverty, high rates of unemployment, and the stress levels related to poor economic status. Low rates of school completion also make it difficult for people to engage in the kinds of health learning that is important for everyone, and the steady rates of immigration make it difficult for people to learn about how to lead a healthy lifestyle due to language and cultural barriers. An example of some of the problems that we have in the city of Fall River, and to some extent in the 3 surrounding towns, are smoking, which continues at a high rate, and then overweight and obesity. You can see the comparison between the city of Fall River and Massachusetts. Though if you also look at the city of Fall River relative to the rest of the population in the country, we're not a whole lot different from that. I like to remind people because in a lot of ways, Massachusetts is one of the more healthy communities in the country. So having a comparison with Massachusetts is in some ways a little unfair. But that's not to say that we don't need to do something about each of those. Those particularly overweight and obesity are connected strongly with diabetes, and you can see that the rate of diabetes in Fall River is much higher than the rest of the state. We're almost 14%, where the rest of the state is just about half of that. And that rate has been going up over the past 10 years. And this is one of the more frightening statistics because diabetes now accounts for, in some hospitals, almost a third of patient admissions are of people with diabetes. Not to say they're necessarily admitted for treatment of diabetes, but when you have that many people coming into medical care systems with diabetes, you have a number of other issues that have to be addressed as well, and it makes treatment more difficult. People are living longer with diabetes and even heart disease because our treatments are better, but the numbers, the percentage of people with that illness is going up steadily, and it's something we really need to address. Partners works on a model of the World Health Organization that has established the way you make a community better is to look at a variety of issues. It's not simply a matter of improving health care, but creating an ongoing dialogue and generating leadership, helping the community look at its own problems, shape its future, embrace diversity, and connect people and resources so that there's a sense of community, and that community then can address those issues. And that's the way we've worked. 10 years ago, when the Healthy City Initiative started, we asked over 1,000 people what would make the city of Fall River a healthier place to live and work. And out of that, we arrived at the 5 major goal areas that we've been working on essentially since that time, now 11 years. And that's been a good guide for us. The action planning that we did 5 years ago in 2009 was based on work that we did in modifying those original 5 areas and focusing more on system, policy, and environment change. We invited Mark Fenton down from Situate to help us. He works for the Robert Wood Johnson Foundation and helps people look at ways of making improvements in the community that really address broad issues and change population norms. So we've added work on the food supply and nutrition, on built environment and transit, and on work site and medical settings. Our focus on policy, system, and environment change is also, let me go back to that slide, has helped us understand that in order to make changes, we have to affect more than the individual behavior of people, but really look at how systems such as government or organizations such as employers or schools can, by changing policies and regulations within the school, affect change within the community. So some of the projects that we've worked on are tobacco, drug laws, alcohol laws, reduction of crime and youth violence, work on school meals and improvements there, and wellness policies in the schools, and improved food supply for the city, youth and adult physical fitness, improving access to health care, which is always an important issue, and integration of health with health care. And finally, a lot of work in the area of parks and open space development and walking paths and bicycle routes, as Ms. Kelly, our Mass in Motion coordinator, has been working on. So briefly, we've looked at enforcing tobacco and drug laws, on smoke-free housing, and we've had a presentation right here in this hearing room to help landlords work towards smoke-free housing. Changing alcohol sales and use laws. The BOLD Coalition has primarily led that effort, and we've gotten a number of changes in our laws, like the social host ordinance and beverage server training, that are now required. We've also looked at crime and youth violence. We work strongly with youth programs in this community, and have over the last 4 years reduced youth violence by 37%, primarily through education, job training, and social support. We also work on improving school meals and wellness. Our school wellness coordinator, Ms. Picard, has worked hard on getting new policies within the schools, working toward elimination of soda, doing a lot of education on sugar-free beverages, working with the physical education teachers to provide support to them, and then working with a number of people in the community on walk and bike to school projects, playground education, and our ongoing series of family fun nights. We've worked on improving the food supply largely through farmers markets, healthy restaurants, healthy neighborhood stores, and work with the Hunger Network. There will be more work in those areas. We also work on after-school and youth fitness. We've had a number of programs in year-round recreation, increasing adult physical fitness through walking routes and events. The Staircase Gallery here at Government Center, walks with hospital doctors, and hikes in the Fall River Forest. Of course, one of our best known efforts has been the Fall River Fitness Challenge, which has brought over 800 people now for 7 years in a row. And we now incorporate actually 8 sites, not just 5, in all kinds of programs, and involved, was it over 7,000 kids in the schools in various challenges, not to lose weight, but to get more fit within the schools. We've also improved access to health care. We now have actually 3 new physical clinics, 2 run by STAR and 1 with the Health First Clinic, a brand new clinic, doing excellent work and including dental care and access, and a major effort to enroll people in health insurance. And finally, we've been integrating health into health care, working with physicians now who are, for instance, the farmers market at St. Anne's Hospital just opened for the season yesterday, and physicians there are writing prescriptions for their patients with diabetes, so they can take a coupon and go out to the farmers market right outside the hospital doors and purchase locally grown produce there at no charge, basically as part of their medical care. And I was with a doctor, a cardiologist over in New Bedford just this Saturday morning, who led a group of nearly 100 people around Buttonwood Park for a 2-mile walk. He's doing that every Saturday morning. Those are examples of how we can get the medical care community involved in doing primary prevention and work within the community by integrating clinical care with the resources that we have in the community. And we look forward to doing more of that as well. And finally, the open space and park development. If you're going to have people out walking, you've got to have good, safe places for people to walk. Julie Kelly in Mass in Motion has been working tirelessly for the past 5 years now to work on identifying areas, creating new parks, and shortly this summer we should see construction beginning on the new Quequechan River bikeway, which will go right through the center of the city and provide over, I think it's 1.7 miles of walking and bicycle paths right in the midst of some of the poorest areas of the city. So that's just one example of ways that we can change the environment so that people are more likely to lead healthier lifestyles. And bicycle routes are now pretty much integrated throughout the city. There are a number of those, and with new Plymouth Avenue construction, there'll be more. So what we've done over the past 10 months now is to review not only what we've done, but what we can do. And that process has gone on with 8 task forces that have looked at all kinds of factors that influence health in this community. And they have then developed a plan using the data sources that we have and additional meetings. We have met with at-risk populations, including populations who only speak Portuguese or Spanish, so we've gotten input from those groups. We've gotten groups, different ethnic and racial groups. We've gotten senior citizens and youth. So there have been efforts throughout this whole period of planning to get input from every sector of the community. And it's that input then that has gone into creating a proposed action plan. That action plan is composed of currently 59 separate objectives that we hope to accomplish over the next 5 years. And We can add to that, that we're in the final stages, and this is really an opportunity for people to review that plan and to give us input. For those people who are watching this on television and won't have a chance to give input directly at this meeting, there will be packets available at each of the libraries, the 3 in Fall River and the 3 in each of the communities, Somerset, Swansea, and Westport. And anyone can go in the library up until the 21st of June and request, there's directions here and an input form that people can complete and leave there at the library. There's plenty of room on the back, so there's lots of room to fill that in. We've also asked for a couple checkoffs in terms of information, but this is very helpful. These forms will also be available at the biggest public event that goes on over the summer, held at Ruggles Park on Saturday, June 21st between noon and 3 o'clock. And there will be a table there for partners that will talk about this whole event and process and give people a chance right there for people to fill out their suggestions about how to make this a healthier community. People can look at the entire 59-page report either online at www.gfrpartners, Greater Fall River Partners.com. There's a link right up the top of the page, or the Healthy City Fall River page. There's a link right on that front page menu. But that will take you to a nice, more colorful, I've got it printed out. This is the way it'll look on the screen. Looks a lot better, lots of colors. To help you work through all of these different objectives. This is a chance for you to say, well, I think we need to do this or change that. And you can take that input, like I say, anytime up through the 21st, and then that will then go to a design team meeting that will be held on June 26th at the Health First Family Care Center, 387 Quarry Street. It's an open meeting. Anyone from the public is invited to come. But at that meeting, we will pretty much put the plan to rest. We will have gotten all of the input and a chance for people throughout the communities to review the plan, and we will have a final vote on that. That plan will then be presented to the public on June 30th and will be available for anyone to look at. That does not mean that that's the end of the process, because we review this plan annually, and we sometimes take some of the objectives off, sometimes we modify them, and certainly we add them as time goes on. So what we're at is a continual process of examining what the factors are in the community that contribute to people's health, what kinds of things that we can do to make the community healthier, and then look at evaluation. How are we doing in that process? Are we beginning to move the needle? Are people leading healthier lives? And are some of the indicators telling us that? So this is your chance. Give us the input and join us anytime, either online at www.gfrpartners.com, or for those living in the city of Fall River, healthycityfallriver.com, where you can see, by the way, examples of literally thousands of events and activities that have taken place over the past 10 years. Many of them now with video, so you can get a better idea of the kinds of things that we've been doing to make this a healthier community, a prize-winning healthy community. So thank you very much, and I'll see if there's any input from the audience.